Welcome to the XDOG Podcast, where our mission is to help dog owners extend the life of their dogs through nutrition, fitness, and education. I am your host, Stan Smith, CEO of XDOG, and whether you're looking for tips on how to improve your dog's overall health, get valuable training details, or insight on personal growth and business development, then you are in the right place. So march with us as we go heads up against your dog's number one enemy, canine obesity, and let's win this battle together. Welcome to another episode of the XDOG Podcast. It's your host, Stan Smith. And today, I'm really excited because I have an extraordinary guest with me, and he goes by the name of Dr. O. What's going on, Dr. O?
Hey, I'm doing great.
So,
glad to be here.
Who is Dr. O? Where did it all start as far as like, what was your first, when did you start actually loving animals, and what made you decide that animal chiropractic and veterinarian was what you wanted to actually get involved in as a career?
So first off, thanks for being here. Let me be on your podcast. It's such an honor to be on the XDOG podcast and to work with XDOGs. I mean, I think that you guys are doing awesome. You have an awesome mission, and it's the right track. So last time I was here, your excitement and drive to do a good job and to educate people on the mission spurred me.
Okay.
So I announced my book.
Yeah.
And this week, which was a month later, I brought you one of the first 10 copies.
Yes.
And it will be published by the 1st of April.
Okay.
So because of that, that question I answered in the book. But it started when I was in 5th or 6th grade. I had a long-haired Chihuahua. Dog's name was Super Squirrel.
Okay. Super Squirrel.
Super Squirrel,
okay.
Long-haired Chihuahua. Came home, and he was dragging his back end. Paralyzed.
Okay.
Took him to the vet. They said, not much hope without spending a lot of money. My folks didn't have a lot of money. Of course, I didn't have any as a 5th grader, so we put him down.
Gotcha.
And I thought, man, that shouldn't happen to people. And so we got started in 4-H. And in the 4-H project, I got involved in veterinary science, had some really good leaders, and they got me going. That's one of the reasons that at our clinic in Meridian, we treat 4-H animals at a reduced rate.
Okay.
If the kids have to do all the talking, though. We don't talk to parents when they bring 4-H animals in. So
why is that?
Because I want the kids to understand what's wrong. They have to tell me what's wrong with their animal, not mommy or daddy. And it's amazing how when they bring in their first time, they'll be like, yeah, well, But boy, after 3 or 4 visits, they're like, this is what's wrong with my sheep, and I know you can fix it. And this is what's wrong, and it works great. It's amazing, and I see that growth. So through the 4-H Veterinary Science Project, I decided I was going to be a vet.
Okay. Got
to be a vet. Wasn't really working. I mean, it worked just as good for me as anybody else. I was a pretty good surgeon. But I've been practicing veterinary medicine for 32 years. Nobody ever quits practicing medicine until they retire. It's always practice. Mm-hmm. You never do it. You just practice.
Okay.
And I mean, how many times have you been to the doctor, human, veterinarian, whatever, and it's, let's try this.
Yeah.
See what happens.
It always seems like there's always some new medicine that's out.
Try the new medicine and see what happens. See if it works in your case. Well, in my case, I happened to go, and my new medicine for me was chiropractic.
Okay.
I learned chiropractic, and I tell people, let's try this. And they say, well, what happens if it doesn't work? Well, the cool thing about chiropractic, if it doesn't work, guess what? What are the side effects of chiropractic?
So, to the audience, how would you define animal chiropractic?
Well, animal chiropractic is the philosophy, art, and science of making sure that the nervous system is free of interference.
Okay.
Because the brain controls every function in the body.
Sure.
Whether it's a snake, a turtle, a dog, or a person, or a horse. If the brain can't communicate with the rest of the body, things are screwed up.
Makes sense.
When there's 2 cells, boom, The first organ that's formed in embryology is the neural tube, which becomes this brain in the nervous system. Everything else that's formed after that is controlled by the nervous system, and is controlled by the nervous system for the rest of its life.
So when we talk about animal chiropractic, what does it actually treat? Like what type of symptoms, and what does it actually treat when it comes to somebody owning, I guess, a horse or a cat or a dog, rabbits?
Okay, so we just saw a bunch of dogs today, and we just saw a bunch of dogs yesterday, and people say, this is what's wrong with my dog, and this, for instance, today. So what do we treat today? One of the dogs we treated today had an endocrine pancreatic insufficiency. So their pancreas wasn't producing enough enzymes. And they were told it's a genetic problem.
Really?
And I said, at what age did this occur? 4. Now, genetic means it was there at birth.
Sure.
So the pancreas worked good for 4 years.
Okay.
And then it quit. So chances of that being a genetic problem aren't very good, because for 4 years it worked and then it didn't. And then she said, and my dog has a back problem too. I said, really? Yeah. Not for sure exactly what the back problem is, but it's got a problem in its back. And I said, oh, when did that start? About 3 months before the pancreas started messing up.
Interesting.
But they're not connected.
Well.
So the brain controls the pancreas via nerves.
Okay.
The nerves go through the backbone and then they exit out. So we did some chiropractic adjustments today. We adjusted the dog's spine. We removed the nervous system interference. Is that going to correct the endocrine pancreatic insufficiency? I don't know. Because all I do as an animal chiropractic is remove nervous interference. But most of the animals that I see, when we talk to people about what the problems are, it's a nervous system problem.
So you said the problem started when he was 4. So when would be a good time, as far as is a dog too young for chiropractic work, or is it you just work on older dogs? How's it when's the best time?
We see dogs when they're born.
Why?
Because birth is the most traumatic experience that all living creatures have survived. Because you have to have some trauma in there in order for the hole that was in your heart in utero to close.
Okay.
The liver doesn't work when you're in utero, and it's got to start working. And you have to go through a period of trauma or shock to the body.
All right.
To get the liver to start working and the hole in the heart to close up. All that stuff has to happen at birth so that you breathe, so that you can live on your own. It's happened to every one of us. Everybody that's listening to this podcast, and every of one of their animals that's alive, that trauma has happened to.
What's the youngest dog you've ever worked on? Was it at birth, actually?
Yeah, it was actually at birth. In fact, a lot of babies that we've worked on, like if I go out to a cow problem, a dystocia, or a sheep or a goat dystocia, like where these animals, mothers are having trouble giving birth, we'll adjust the mother first.
Okay.
A lot of times that takes so what happens is you have a hole like this, and it gets a subluxation, so it makes the hole seem smaller.
Okay.
But when you put it back into the correct position, the hole is bigger again. It allows the baby to come out. So we adjust both mama and baby right at birth. So some of them we've adjusted before they ever dry up. Now, you asked me a minute ago what Dr. O does. So we do the clinic, but we also teach veterinarians and chiropractors.
Yeah, speak about that. Talk to I guess, let them know about your actual school and why it created, when it was created.
Well, it was started because I was broke to get CE, but we've trained about 700 doctors now. And one day my phone rang at 4:00 in the morning, so I answered it. And it was a student, and they were like, "Oh my God, Dr. O, oh my God, this stuff works." Yeah. And I'm like, "You couldn't have waited a couple hours?" And you're like, hey. "Oh, great. Well, I'm awake now, so tell me about it." She goes, "Well, I had this dummy foal. This foal wouldn't suck. He couldn't find where the milk was."
Yeah.
So we were milking the mama and feeding the baby, We started at 8 o'clock last night. I did it at 8 o'clock and 10 o'clock and 12 and 2. She goes, and so I was having trouble getting back to sleep, so I was studying for your course.
Yeah.
And she goes, I was up for the 4 o'clock feeding, and I thought, I wonder if that horse's atlas is messed up. So she said, I adjusted the atlas, and then I went to get the stuff so I could milk Mama to get the milk.
Yeah.
And they came back, and he was eating.
Interesting.
She goes, and so my first thought was, why didn't you do that at 8 o'clock last night?
Yeah. Didn't happen.
Didn't happen. So it happens. But so you ask when, it's never too early.
Yeah. So why does animal chiropractic make sense?
Well, because of what we're talking about, the nervous system controls everything in the body. It controls, it controls our appetite, your dog's appetite, whether he's hungry, whether he wants to get off the couch, whether he's apathetic. It controls his immune system, whether he can fight the viruses that are out there, whether he succumbs to the viruses that are out there, bacteria. There's bacteria all over the place. And if bacteria were truly as bad as some people make it out to be, then why doesn't every dog get sick? Why doesn't, one of the things where I'm sure we're going to have to discuss at one of our, in the future podcast, it's not on the board for today, but is, what about salmonella in raw food? Well, every dog never gets salmonella.
But why is that? Explain that, because we get this quite often. We get this question quite often.
Well, one reason is that dogs don't succumb to it because their GI tract is too short. The acidity of the tract is higher than it is in a human. Salmonella is not a problem for a healthy dog.
Okay.
So if you have a dog that's on chemotherapy drugs, then maybe it might be a problem.
Okay.
I've only read about a couple cases.
Gotcha.
And they were both in dogs that were immunocompromised.
I know earlier today you talked about a lot of the issues when you're working on some of the dog starts in the atlas. Why is that?
Why is it the atlas? Well, all right. So first off, the atlas, for everybody that doesn't know, is the first cervical vertebra. It sits right here, right under the base of our skull, and it sits right behind the ears in your dog.
Okay.
All but 2 nerves go through there. And so it becomes an issue because all but 2 nerves go through there. So we're talking about control of the nervous system. We know that the weight of a feather decreases nerve transmission by 60%.
How do you even know that?
There's a guy at Colorado State, guy by the name of Dr. Sue, did a whole bunch of experimentation on it, and he came up, and that's in the medical profession, that's a given, that now that we understand that he's done enough work to produce that. So the weight of a feather decreases nerve transmission. So just think about that. So what's nerve transmission? Think about your cell phone.
Okay.
And your bars.
Yes.
So when you have 5 bars, that's 100% transmission, right?
Yep.
When you have 1 bar, that's not so much.
Okay.
If you need 5 bars, you can hear, you and I are talking on cell phone, 5 bars, we don't miss much.
Yeah.
4 bars, 3 bars. If I'm down to 1 bar, you'll be saying, Dr. O, I'm only,
Yeah.
and we're not communicating. And that's what happens when we get nerve problems with our organs. So anywhere, and every nerve in the body.
Is that what you adjusted on with the pup today?
Yep, just adjusted the atlas, yep, and we made a huge difference.
Because the owner made reference to where the dog was scrouching down, and then once you adjusted the atlas, it kind of solved that problem.
Yeah, so the dog had a listing, and
what's a listing?
It's like a disease.
Okay.
So in veterinary medicine, I would have said, oh, he's got a sore neck. That's a diagnosis, sore neck.
Okay.
So in chiropractic, we say it's a listing. So the listing was the atlas was inferior.
Okay.
That's the way it was stuck, basically.
All right.
So I adjusted it so it wasn't stuck that way anymore. But with an atlas inferior listing, you have a tendency to. So if mine, I wouldn't be able to look up at you. So, it'd be kind of. So I wouldn't.
What do you think may have caused that?
Good. Probably birth.
Yeah.
Birth is the most common cause of those subluxations in that atlas. It happens. It's very traumatic. It's probably been there because she had seen that was that. Or it could have been playing with one of its siblings. Who knows? You know, puppies rough house all the time. That's part of normal growing up.
Now, how often would you suggest, let's say if in her case, to get her puppy adjusted right now to probably, I guess, fix the solution so it's not long-term, I guess?
So we adjusted it today, and I showed her some exercises to do, which I try to do with most people. We do some exercises, and we're working on getting some muscle charts so all the viewers can do those exercises. Those, I'd say probably within a month or so we'll have those up.
Okay.
On the website, so they'll be able to get those. But we'll have some exercises that they can do. But I gave them some exercises to do, and that she's going to do those exercises. And as long as that puppy can continue to do those exercises, then probably maybe a couple months for a puppy that age, because it was a young puppy. But maybe in a week, if it can't do those exercises, then we need to get him adjusted again.
Would you ever say that animal chiropractor doesn't work?
No. We've seen dogs that now we might not adjust every joint in a dog's body. So we do a lot of work with American Boston Terrier Rescue and Rehab.
Okay.
They're a rescue group out of Dallas, and they specialize in geriatric and special needs Boston Terriers.
Okay.
They get dogs from all over the country. They get hit by car dogs. They get them out of shelters. They get all kinds of stuff. Some of those dogs come in, and we have no idea what's going on with them. But when we feel them, and one dog came in with a fractured bone in the middle of his back.
Okay.
We didn't adjust that bone. We adjusted his atlas. Surgery wasn't an option for the rescue. They didn't have the money to do the back surgery. So we adjusted him. He started eating within a day. Okay. We were monitoring his vital signs. We were watching him for pain, all that. He was doing fine. We kept adjusting him, but we never adjusted his back. Now, 2 years later, he can stand up.
Okay.
Now, did it work? I mean, he's not a puppy.
Yeah.
He doesn't have full use of his back legs.
Yeah.
But he was hit by a car. His spine is probably severed, and not completely, because we do have some control back, but boy, it was pretty close. And he's happy, and when he's in his wheelchair, look out, dude.
Yeah.
So was chiropractic successful? You bet, because it saved his life, and he's doing great.
Sure. So you're both a chiropractor and a veterinarian. Do you consider yourself a practicing veterinarian?
Well, yeah.
Because you don't use drugs, right? I mean, that's pretty much the difference between your veterinarian clinic, I guess, and what the everyday dog owner would consider, or how we've been educated at veterinarian. What's the kind of like the biggest difference outside of just not using drugs?
Biggest one is that we don't use drugs.
But why do you not use that?
We have a different philosophy.
Okay.
And it really was complicated for me. It was hard because I was a veterinarian, and the switch to go from being a traditional veterinarian to being just an animal chiropractor, and in the middle, you're doing both. And a lot of people do that. And it's like, so you bring your dog to me, and I'm like, let's try chiropractic. And you go, well, I heard about this new drug.
Yeah.
Why don't we try that? Well, okay, but that new drug has these side effects. Well, I'm willing to take that. I don't think it's worth it for your dog. Well, I'm willing to take that effect. Well, that's okay then. And I would, as a traditional vet, I would have to go ahead and fill your prescription. But now, the way we work, our sign right outside our gate says drug-free veterinary rehab facility. We don't do any drugs. We don't use any drugs on animals whatsoever. So you come in, we're going to do chiropractic adjustments. We're going to use better nutrition, and maybe some cold laser and some homeopathy in really severe cases. But for the most part, just chiropractic.
What is cold laser?
Cold laser works on energy. It helps the cells convert their nutrition to energy that the cell can use, basically.
Well, speaking of nutrition, what's your philosophy on how people and dog owners should actually feed their dogs? Like, what's your viewpoint of what you feel is the best way to nourish your dog's body?
Well, as natural as possible. So to me, that means that we should feed raw food.
Okay.
Now I know there's some people that say you can't, and we've all been, we all have the paradigm that, commercial dog food is the best and kibble's the best, and we have to feed kibble because that's what we've been taught. Mm-hmm. And I think we need to change that, and I think there's a lot of research out there. We just have to realize what it is and not look at the headlines, because the headlines say, one dog, they found salmonella. Mm-hmm. One family, they found, and they actually find more salmonella cases in kibble than in most of the commercially available raw food right now.
So you think a lot of the stories are fabricated to?
I don't think they're fabricated, but what I think is that what happens in the media is the media likes headlines. Mm-hmm. And number two is that we can look at data however we want. Sure. So we can clump stuff together. And if I'm doing a kibble research,
okay,
there's good kibble and there's medium kibble and there's bad kibble. And we're going to compare medium kibble and good kibble to the excellent kibble. Mm-hmm. All right? And that would be my research project.
Yeah. And
what happens in raw is that they compare all raw dog food, mm-hmm. which means that they're comparing all the people that feed their dogs raw food. Now, I'm a pretty smart fella, and you're a pretty smart fella.
All right. Appreciate that.
Have you ever tried to make your own balanced raw dog food?
I've tried. I mean, as far as just yeah.
And how'd that go? How'd that work for you?
It's pretty challenging because, especially when you have multiple different dogs who react differently. Like, people don't, that's another thing I always think about, is that when they talk about raw or people try to feed raw, they don't also tell you, like, if you do it wrong, there's some things that'll backfire on you.
Well, not only that, but like you said, the balancing. And if you go buy chicken at the grocery store one time, it's got more fat on it than the next time you go buy chicken, and you bite the chicken and it's a little leaner, mm-hmm. right? And how do you know the fat content and the protein content and the calcium content? I mean, how many, I'm sure most people, have you ever, I think I saw some farm-raised eggs in the refrigerator. And when you break those, sometimes they're hard to break, right?
Yeah, a little bit harder to break. The yolk's a lot more yellow or orange. So you can taste the difference for sure.
You can taste the difference, but if you feed those eggshells mm-hmm. to your dogs,
yes,
versus store-bought eggshells that explode when you break them, mm-hmm. okay, why do they explode? There's not very much calcium in it. Yeah. So 6 eggshells is not the same if it's store-bought eggshells versus organic eggshells. So that messes. So now we're a little low on calcium. So we got to add some calcium from somewhere else. Mm-hmm. There's 38 different minerals and vitamins that alter calcium absorption and utilization in the diet.
Wow.
Okay. So if one's up, it's going to drop calcium, and if one's low, it's going to
So what would be the solution for someone who's really wanting to feed their dog a biologically appropriate diet, but you're taking the guesswork out of it? Because it can be difficult. Like, for example, a lot of people feel like throwing some burger and some chicken in a bowl is feeding your dog a balanced raw diet, but obviously that's not the case.
Not the case. Commercially available raw food is the only way to go. It has a 0 salmonella tolerance. Okay. I'd use a company that's been around for a long period of time, mm-hmm. Which I'm pretty sure that even though you guys are just coming out with the raw food, yeah. I'm pretty sure you're going to be using it from a source that's been around for a while, because you just wouldn't do that. So you want to use somebody that's been around for a while. You want to look at their track record, and the biggest difference is they have a 0 salmonella tolerance coming out of the factory. Mm-hmm. You know that 27% of the chickens in any grocery store can be infected with salmonella, and that's okay. They won't close the grocery store down.
Wow.
Okay. 72% of the lettuce in any grocery store can have salmonella in it before they'll recall it.
That's crazy.
Yep. So, but 0% of dog food can have it.
Yeah.
Okay. So when they start looking at salmonella in raw dog food, where did the ingredients come from? Was it a commercial raw dog food which has a 0 salmonella tolerance, or did people go to the grocery store and buy food for their dogs, go home and blend it themselves? See, so 27% of those people picked chicken that had salmonella in it and didn't even know it.
Okay.
And then, I mean, I'm guilty. I've had clients do this before. If you're going to go buy chicken just for your dog, are you going to buy the expensive stuff, or do you always look in that
$5 big giant 10-pound bundle bag?
Yeah, sell by tonight.
Yeah.
Yeah, you're going to buy that. Which one's more likely to have salmonella in it?
That one.
That one, because it's been sitting around for a long time.
So, is it a thing? Why did you title your book, Is It a Thing?
Is it a thing? Because I hear people ask that all the time. Animal chiropractic? Is that even a thing?
Yeah.
You know, they'll ask me, or like, I lived in Salina, Texas before I moved to the ranch, and I lived there for a little over 10 years.
Okay.
And I was even there at the end of I'd been there for over 10 years, had animal chiropractic on my truck all over, thought I was being pretty vocal.
Yeah.
You know, it was before social media was just getting started.
Sure.
But still, I thought I was pretty vocal. And sitting at the convenience store, and this guy in front of me talking to the clerk, and he goes, "Do you see that truck out there? Animal chiropractic, is that a thing?"
Yeah.
And I mean, and I'm still hearing it 8 years later. So, yeah, it is a thing.
Well, without giving a spoiler, what can people expect out of your book?
We're going to answer a lot of the questions in more detail than we have today. What is animal chiropractic? Who, you know, a little bit more in depth about me, so you can get to know, like, and trust me more.
Yeah.
And then what chiropractic treats,
Okay.
and if chiropractic's not working for your animal, why it may not be working, and more than anything, how to find an animal chiropractic and know if they're doing a good job.
Sure.
How to find somebody in your area. So.
Good. Well, it sounds like it's going to be an amazing book. How can people find you?
So find me through XDOG.
Yeah.
All right.
Yeah, we will be having a landing page on our site, so we'll have all his contact information.
All of this, and in the meantime, before the landing page there, just, you know, if they contact you through XDOG, or All Creatures Every Spine is our clinic, and you know, if you're having some problems, we do some consults, some long distance consults to help you find somebody in your area. You can go to All Creatures Every Spine and schedule a consult, schedule a nutritional consult, and we'll be glad to help you, talk to you with our problems about your dogs. We have some short 15-minute consults, and then we have some extended consults, so whichever one you need.
Well, Dr. O, I appreciate your time. It's been an honor to have you on here. I'm excited about it. And guys and gals, thank you for tuning in today's episode. It's you know, he's doing this out of his pocket for absolutely free. We're trying to give you as much value and education for free. We ask that if you could just like and share and just show us some love, leave us a comment, and also within future shows, ask some questions ask some questions when you leave your review, and we'll try to address them in future episodes. But again, thank you guys so much, man. We couldn't do it without your support, and as always, our mission is to you know, go after canine obesity in the year 2020 is round one, and man, we are honored to have you a part of our mission and part of our team. And as always, Team XDOG strong.